Welcome, I'm Ryan. I'm one of the physical therapists for Mercy Medical Center, and if you're watching this video, you are scheduled to have a total knee. My job as a physical therapist will kind of be able to review how the therapy stay will be going at the hospital while using a walker to do the stairs, getting in and out of chairs, and we'll practice getting out of the bed once you're on the hospital floor. So goals of today to educate you on what I would like you to do before the surgery, what to expect during your hospital stay, and kind of our discharge planning. So first off, we'll start with what to do before the surgery. The first thing we'd like you to do is you're going to attend your PACE appointment. At that PACE appointment, they're going to give you this nice little joint book here. This joint book will include some information that pertains to physical therapy. The big tabs from a physical therapy standpoint are the going home tab. Within that, it'll contain how we're going to be getting in and out of chairs, how we'll be walking with a walker, and how we'll be doing the stairs. All things that we'll review while you're at the hospital, but things that you can review back on when you go home. The second tab that's important for us is a total knee exercise program. There'll be 5 exercises contained within this booklet that you'll do within the bed, and then 2 exercises that you do when you're sitting on the edge of the bed or in a chair. We do ask that you try these exercises before you have your surgery. Research has shown that people who are able to do the exercises and have a better understanding or foundation before they come for the surgery have better outcomes following. The big caveat with that is I'd like to do the exercises, but also at the same point without increasing your pain too much. So don't fret or don't worry if you're unable to do the exercises because it's resulting in too much pain. You'll have plenty of practice when you come to the hospital. The next thing I'd like to talk to you about you'll receive from the PACE appointment is a home setup sheet. This home setup sheet we do request that you fill out, and it'll be an intricate part of our therapy with our goals that we establish for you for when you're here. On that home setup sheet, it talks about what your prior level function was. Were you using a walker or a cane? Were you limited in how far you could walk? Second, what your housing setup is like. Do you have stairs? Do you have railings that you can use on those stairs? Are you able to live on the main level, or do you have to go upstairs to a bedroom or a bathroom? Those are all important things for us to know as a physical therapy team to ensure that we are safe and ready to go home from the discharge from the hospital. The last parts on that sheet talk about who potentially a care partner may be. A care partner is someone that we involve in your treatment session. This can be family or friends to give a more hands-on approach so there's good carryover or understanding with going home. You don't have to have a care partner, but it's something that we do encourage because we will be giving you a lot of education while you're here. Again, if you forget anything from your education that we give you while in the hospital, this is your good reference tool, this joint book. The last part on that home setup sheet talks about kind of your discharge plan. This is something we'll talk to you about while you're in the hospital, but we want you kind of thinking about it before you come in. What I mean by that is a discharge plan is you're going to be doing some therapy in some location once you leave here, whether it be in a skilled nursing facility, at home with a home therapist, or in an outpatient clinic. We'd like you to have a kind of an idea of what you'd like to do as a goal, and together we'll try to achieve that goal for you. Other things I'd like you to try to achieve before you come to the hospital for this surgery is I'd like you to try to obtain a walker. The walker that we're looking at is a standard walker to start. So what I mean by standard, it has 4 posts on this walker. As you can see, there's no wheels. We want you to start off with a walker like this for safety, so the walker doesn't get away from you. And again, I'll show you when we get done how I'll be walking with this walker. The one caveat I'd like to stress is we do want you to try to get a walker that has the options of wheels. So what I mean by that is where 2 wheels would go on the front post here. Again, we'll start with a walker without wheels, but if you have the option to have wheels following the hospital discharge, we'd like to progress to that eventually. So try to get both options if you're able to. Otherwise, if you're not able to obtain a walker, we'll kind of talk through the process and see what we can do to help kind of make sure we get that for you before you leave. So again, we want a walker without wheels on it to start, but try to get the option of the wheels to for additional help. The next thing I'd like to talk about is kind of your hospital stay. So those are the main things I'd like you to do before you come to the hospital. Go to your PACE appointment, get your joint book, fill out your home setup sheet, try to obtain a standard walker, try to do some of the exercises if you're able to without causing too much pain, and try to decide if you're going to potentially have a care partner or what your discharge plan may be, whether again that be home, outpatient clinic, or going to a skilled facility. So the hospital stay. This is the biggest part where we come in. So you'll come to the hospital, for this example, you're having surgery on a Monday. Surgery, you end up on our 3rd floor here, then at the hospital at Mercy. On the 3rd floor, the physical therapist, myself, or another team member will be assessing when you're ready to participate in therapy. Usually game plan for no earlier than an hour to when you come to the floor. So let's say you get to the floor about noon on Monday. Anticipate us stopping in between 1 and 1:30 or discussing with your nurse when you're ready to work with therapy. So as mentioned, anticipate us coming in that first day of surgery. That first day of surgery, what our goals kind of are for A, to talk to you a little bit. That's why that home setup sheet is important that you'll receive in PACE. We want to do some exercises with you, the same ones that are in this book that we talked about. We'd like to get you sitting on the edge of the bed and potentially walking that very first day. So that's kind of an expectation of the first day when I come and see you. Again, like I said, anticipate us being within like an hour to an hour and a half of when you arrive to our floor here. And maybe later, depending on the anesthesia that you had, but we'll be in discussion with the nursing staff throughout to see when you're appropriate and ready to start physical therapy. So that's what we call post-op day 0. That's the first time we see you. Physical therapy will see you that first day, but then my colleague will talk to you in the second part of this video. Occupational therapy will start post-op day 1, or the day after surgery. The difference between the two is physical therapy, we deal with your mobility. So walking, getting out of bed, sitting to standing, doing stairs, whereas occupational therapy deals with activities of daily living, bathing, dressing, toileting, that kind of stuff. So you'll see both of us during your hospital stay, but as a physical therapy team, we'll be the only ones that see you what's called post-op day 0, or the day of your surgery. So you did great, post-op day 0. We got you out of bed, we walked you, you hit a bathroom, which is always important. We did the exercises, we get you back into bed, we get ice packs on you, because that's going to be your friend while you're here, because we do expect you to have pain. You had a big surgery. So our goal is to keep pain under control. With the nursing staff, we'll be in charge of your pain medications, but we'll give you ice throughout your hospital stay to also help with that. So you get back in bed, you rest. Your goal for the rest of the day is potentially try to do 2 more walks with the staff. You have a patient care tech assigned to each of your rooms. They'll be in charge with walking you throughout the evening. So you just call them when you're ready to go, usually if you have to go to the bathroom, and they'll take you on a little bit longer walk. The physical therapy team will be in contact with the nursing and the patient care tech to let them know how you did with us the first time, to give them recommendations on how you'll do the rest of the night with them. All right, you got a good night's sleep, and then we come back in the morning, post-op day 1. So for this example, like I said, you had surgery on Monday. We're coming back Tuesday morning to work with you. Physical therapy again. Our plan is to do the exercises, to do the walk-in. Most likely hit the restroom again, and then get you up in the chair for breakfast. We want to try to get you sitting up, kind of feel that knee starting to bend. We also have occupational therapy kind of get in the mix at that point. So physical therapy and occupational therapy will be in close communication to see when you're ready to work with both of us. So physical therapy, you check that off the list for that first morning. We come back in the afternoon. So this is when the care partner training program comes into play. So game plan for the care partner program to have your family or friends be present for the second treatment on the first day. So for this example, that'd be Tuesday afternoon. Plan it between 1 and 4 p.m. We kind of say we're like the cable guy. We'll show up between that time frame. The reason why we give that range is we want to be around your pain medication as much as you can. We want to make sure that you're working at your optimal level. Because again, we expect you to have pain. You had a huge surgery, and we're going to work through it together to make sure you're functioning at your highest level. All right. Then after that, we're kind of assessing the whole time of when it's going to be appropriate for you to discharge home. Goals for physical therapy usually are, we want you to be able to get in and out of bed, whether it be with yourself or if you have a care partner, with your care partner. We want you to be able to sit from the bed up into standing, or potentially from a chair up into standing. We want you to be able to walk, and walk with the standard walker as mentioned, and be safe when you're up and moving. And also if you have to, then complete the stairs. So those are things that we'll kind of have as therapy goals for why you're here. We'll kind of educate you throughout the process and how you're progressing to those goals. You also notice when we're working with you with the exercises, we're going to be measuring what's called your extension and your flexion. Your extension is how much you're able to straighten out your leg. You'll notice we'll be measuring that when you're sitting or laying down in bed. And then following, we'll measure with the exercise when you're sitting up, trying to bend the knee, how much you're able to flex or bend that knee. Goal with that bend is to try to get to about 90 degrees during the hospital stay. Everyone's different when they're here, but the ultimate goal following your extended discharge from physical therapy is about 110, 120, 125 as far as the knee flexion is concerned, or the knee bend. as far as the extension is concerned, the straight, we want to try to get to 0 or flat. So those are all goals that we'll kind of talk to you about for while you're here. Those goals don't have to be achieved while you're here in the hospital. Those are just things we're striving for throughout your therapy stay, either here or then when you go home with home services or outpatient or the skilled facility. All right. So post-op day 1 afternoon, the care partner training's done. You did your stairs great. You get out on the bed doing really well. You know the exercises. We're talking about going home. So anticipate potentially leaving that day in the afternoon. So plan accordingly as far as rides are concerned, and we'll kind of discuss this with you. The biggest thing, like I said, that discharge plan is be something we'll be talking about throughout the process of while you're here. This shouldn't come to a surprise to you. If you're doing well, progressing the way we think you should, we're ready to go home. And I know all of us, we feel like we sleep a lot better at home. We've been bugging you all night and throughout the day, so it'd be nice to kind of get home. All right, so those are kind of the main things that we'll achieve during your hospital stay here with the physical therapy team, and later Amy from OT will kind of talk to you about kind of their goals from the occupational therapy standpoint. So big recommendations I want to talk to you about before you come in, assessing your house at home, are chairs. We want you sitting in chairs that are about 20 to 21 inches tall and have arms that you can push up of to help facilitate that sit to stand transfer, to make it easier to get up into standing. So usually that means recliners are out. We usually sit too low in recliners and they make it challenging to get out of. The second thing I always like to make a recommendation of is if you have more than 2 steps to get into your house, we want you to try to maybe have rails installed. It's going to make things a lot easier to get into your house if you have a rail you can hold on to. Other than that, therapy-wise, we'll be game planning, like if your stairs are too narrow to fit a walker, potentially maybe utilize a cane, and we can make recommendations for that while you're in the hospital. Other than that, big thing we want to talk about is falls. That's something we always want to avoid, surgery or no surgery. So caveats or things you can do at home before the surgery would be installing night lights, making sure you have well-lit areas when you're up and moving to try to go to the bathroom in the middle of the night, that kind of stuff. But also maybe try to decrease in how many times you're getting up and down by maybe having like a glass of water next to your bed if you get thirsty at night. That may help facilitate or keep you safe throughout the evening, because sometimes you get disoriented at night and forget that you're using a walker and that kind of stuff. So we want to make sure we keep you safe. Otherwise, the last thing would be a recommendation of shoes. We'd like you to wear good shoes with nice traction on the bottom. Slip-ons are okay, but if they are slip-ons, we want to make sure they're tight so when you're walking, your feet aren't sliding within the shoe. We want to make sure that you're able to keep that traction and keep you safe and avoiding falls. All right, so now I'll show you kind of how we'll be doing these different things. Like I said, we'll start with how you'll be walking with using this standard walker without any wheels. So for this demonstration, I'll say my surgery was on my right leg. So with this walker, what I'll be doing when I'm standing up, I move the walker in front of me, and I'll kind of turn so you can see. I'm moving the walker in front so the back posts are lined up with my toes. You don't want to be reaching way out because you lose the safety of the walker, but you don't want to be too close either because it kind of loses the stability component. So I've put my walker out a good distance in front of me. I'm moving with my surgical leg first. The reason we do that is I'm able to put some weight through my hands and then to transfer my good leg just to catch up with my surgical leg. So again, it's the walker goes first, followed by my surgical leg, catching up with my good leg. Walker, surgical leg, catch up with my good leg. So that's how we'll be walking with this walker. Now I'll show you how we'll be utilizing the walker on a stair. So we have 2 different types of stairs that we'll show you today. One would be if you're able to put the walker entirely on the step or utilizing like a platform step. So we get nice and close to the stair. We put the walker up in front of me first. Again, for this purpose, this demonstration of my surgical leg is my right leg. So we say we go up with the good leg first. So the good goes to heaven, the bad goes, well, you can fill in the blanks there. So we're going to go up with my good leg. We do that because that way I can put all my weight on my good leg to bring my surgical leg up and follow through. So now we've achieved to the top of the steps. How do we get down? Well, we come to the edge, we put the walker down first, and as mentioned before, we go down with the bad leg. So it's up with the good, down with the bad. My surgical leg or my bad leg's coming down first, following with my good leg. So let's say you don't have a step that can fit the walker on it completely. So what we like to do then is we utilize the walker at an angle. So what I mean by that, we put the walker at my side, so it's on the step that I'm on, or on the floor, on the step that I'm going to. The sequencing of the legs is the same. So as you can see, this would be nice. This is why it would be nice to have a rail to hold on to, or otherwise we'll educate you on how to use your care partner to get up and down these steps. Again, the same sequence. We go up with the good, my left leg's my good, follow with my surgical. And we just kind of move it up, just successive steps. Now when we're going down, the walker again is positioned sideways on the step that I'm on, step that I'm going to. We go down with our bad leg first. So again, for this demonstration, my bad leg is my right leg. Down with the bad, follow with the good. Again, you can see why it might be nice to have a rail with that. Again, too, as you can notice, the walker takes up a lot of room. And so, if need be, we'll give you an education on maybe utilizing the cane for these steps so that you have enough room to clear your hips or your knees to get up onto the step without compromising safety. So this is something that we'll go over while you're in the hospital. And if you have a cane, let us know. We have plenty here at the hospital we can practice with to give you good carryover for home. All right, so that's how we'll be doing the stairs. Now the last part, how we're getting in and out on the chairs. So I've gotten over to this chair. I'm going to start in the seated position here. And so the first thing I'm going to have you do in this chair, as you noticed, it's a nice high chair with arms. This is kind of what we recommend for home. The first thing I'm going to have you do, again, my surgical leg is my right leg. We'll kick that right leg out. I'm going to scoot towards the edge of the chair. I'm going to put one hand on the walker. One hand is pushing off of the arm of the chair. When I go into standing, I'm pushing off from the arm of the chair. We stand up, and we slide that leg back to even us out to get into that walking pattern of the walker, surgical, and follow with the good. All right, so I know I've kind of flooded you with a lot of information there all at once. As mentioned, the joint book is a great place to find everything that we just went through. How to do the stairs with a cane or with the walker, how to use the walker when you're walking, and how to get in and out of chairs. As mentioned before, try to do these exercises in here too. If they are too painful, just kind of get used to them or be aware of them, and in turn, your outcomes will be better down the road. So like I said, you're going to have pain, but this little lasting pain here is great in compared to the lifetime of function and independence that you'll have following this surgery. So you'll be sure happy that you did it. All right, so like I said, we'll look forward to seeing you day of your surgery. Physical therapy will be coming in to see you, working with you. Biggest reason for that is mobility is key. We want to get you up and moving, and with the goal of getting you where you'd like to be. All right, so we'll see you when you come for your surgery. Take care.
Hi, my name is Amy. I'm an occupational therapist here at Mercy Hospital. Welcome to the occupational therapy portion of joint class. If you're unfamiliar with OT, we work on your self-cares, things like dressing, bathing, grooming, hygiene after toileting, all the things you do every day to take care of yourself. We make sure after your joint replacement surgery, you're able to do those things just as well as you did them before. We also teach your care partner, whether it's a spouse or a family member or a neighbor, we teach them how to help you with these things as well to allow you to be as independent as possible when you return home. So when you come after your joint replacement surgery, we would like you to bring in a comfortable set of clothing. I suggest at least a couple sets just in case. Shoe-wise, we like you to have something that has a back on them. We don't like a shoe that can easily slip off of your foot, nothing like a flip-flop, anything like that. We like them to have a back like a tennis shoe. We realize, of course, that tennis shoes tend to have shoelaces, which can be hard for you to access right after your surgery. They sell elastic shoelaces, if that were to be the case, or they're slip-on shoes, as long as they stay on your foot and are comfortable. As far as pants, we like ones that have an elastic waist, nothing like jeans or any slacks that have a fasten in the front. Those tend to be a little harder to get on and off, so wear something comfortable. This is a chance to wear your loungewear, your pajama pants, gym shorts, things like that. So we're going to be going over some different kinds of equipment. We'll be going over adaptive equipment for the shower, things for getting dressed, all sorts of good things. So the first thing we're going to talk about are your TED hose, these long white socks. You may or may not already be familiar with these from prior hospitalizations. They are worn to prevent blood clots. The doctors will often ask that you wear them for about 3 to 6 weeks after surgery, at least until you see them for your post-op appointment. You wear them for 23 out of 24 hours of the day. Typically, people take them off to take a shower, and then they get right back on. The hardest thing about these TED hose is not necessarily wearing them, but it's getting them on and off. And so we have a lot of different techniques that you can use in order to make this easy as possible. If you have a caregiver who's willing to help, we use what's called the bag technique. We put a plastic bag over the toes and over the foot, and then you slide this on right after it. The plastic kind of acts as an agent to kind of help eliminate the friction of your foot. You'll notice that I'm holding a thigh-high TED hose. They also come in a knee-high version. Your doctor will determine which one he wants you to wear after surgery. Insurance will cover your first pair. And if you want to purchase a second while you're here, you're certainly welcome to. Just let your nurse know, and she'll get that for you before you leave. For washing them, I would highly suggest cold water, a little bit of soap, and hand washing them in the sink, and then hang to dry. Absolutely no dryers. They're tight enough, and they will shrink if they're in a dryer. So if you put them in front of a fan, or you put them outside on a nice day where there's a little bit of a breeze, they should be dry quickly. It will likely take longer than an hour to dry. Don't let this concern you if you didn't purchase a second pair. As soon as they're dry, just go ahead and put them back on. Another way to get them on is with a sock aid. There are 2 different sizes that we use. This is a wide square. Men typically use this one. They're a little bit bigger, allow for more room. And this is a regular size. Women typically tend to prefer this, but we have had it where it kind of flip-flops, and men prefer this one. So what you're going to do, if you do have a sock aid, you'll match up the top with the top and the bottom with the bottom. You'll put this on like so. I like to turn it on its side and then kind of squeeze the ends together. This allows me to have a little extra grip, because you'll need some grip strength in order to do this. So I get it all the way down so that the toes are at the very end. There's kind of a little pocket for the toes. You'll notice there'll be a nice opening right here for your foot. Then you're going to go fishing. You're going to cast this out in front of you onto the floor, and then you'll slip your foot inside like so. So in order to get a good demonstration of what that looks like, if my hand is my foot, I'll pull it on like so. Some days, of course, it will work better than others. It may go up all the way as high as you want it to, and other days it may just barely make it past your heel. The more you do it, the better you get at it, and you find the little tricks and techniques that work for you. So now, and one other thing I should mention about those TED hose, we highly encourage you to bend down and put them on yourself the old-fashioned way. Bending your knee is good. It's going to promote healing, but we understand, of course, that there's soreness, there's pain with the incision, and not many people can tolerate that right away. So that's where having a care partner helping you or using some of this equipment can be very helpful. But if you can do it yourself, that's the best way. Now let's talk about how to get them off. We use what is called a dressing stick. It's kind of a wooden dowel with a funny little prong on the end. We use the end, and we hook onto the sock at the bottom, and you'll push down. Let's see if I'm wearing high enough socks. So you'll push down off and past your heel. Of course, with my tennis shoes, it won't work too well, but you get the idea. It slides down and off your foot. Another piece of equipment that we use is a long shoehorn. Many of you probably already have these in your home. This is a little more sturdy one. It's made of metal. They also have ones that are available in plastic. Most people are familiar with shoehorns. You stick them down into your foot and slide your heel in. Very basic. The most common form of equipment that I recommend to my patients is called a reacher. Some people also call it a grabber. Of course, it grabs things up off the floor. Very easy to eliminate you having to bend down. People also use it for lightweight items that are up high, grabbing them off of shelves. And the other thing that most people don't think to use is for dressing. If you have your pants or your underwear and you grab them at the waist, you lower it down to the floor, and then you would get the bad leg through first, the surgical leg, the one that hurts the most. That's the one you start with. You thread that through the pant leg, and then you come back and do the good leg. And then, of course, you stand up and pull them up to your waist. And again, if you can bend down and do that yourself, we highly encourage it. But just as getting socks on, if you couldn't do that before the surgery, you're probably not going to be able to do that right after. So keep that in mind. One of the last smaller pieces of equipment I go over is called a toileting aid. We need to make sure after your surgery that you're able to reach in back to clean yourself. And so some people have a hard time doing that. Typically after a surgery, if you could do it before, you're able to do it afterwards, but just in case, we like to show you what's available out there. So this is a toilet tongs. This is the most common form of equipment we use. You'll notice it's a little different from the typical tongs you find in the kitchen. It's got a plastic or a rubber coating around the end, and they also have a bit of an angle. That allows you to get in back a little bit easier. You take the toilet paper, wrap it around the end, you reach back and wipe, and you drop it into the toilet. Pretty simple. Okay. Another form of equipment sometimes can be different walker bags, baskets, things that you can attach onto the walker to allow you to be as independent as possible. Please keep in mind that with the walker, we don't like you to try to carry anything in your hand and move the walker at the same time. It just promotes increased risk for falls, and we would rather have you use an attachment that will allow you to carry items rather than carrying them in your hand. This is especially important in the kitchen when you're carrying a plate of food from one location to another. We would prefer that you use the countertops. You slide the item along and you go from there. So now let's talk about your bathroom setup. If you have a walk-in shower or a tub shower, that will determine kind of what we recommend that you use when you're going in there. So for all of my patients for in the shower, I recommend that they use a shower chair. With a joint replacement, you are at a higher risk for falls, and bathing is the #1 thing people are doing when they tend to fall at home. So we'd like you to have a shower chair when you're showering. They come with or without a backrest. If you have good trunk support and you don't need that extra support in back, I highly recommend going without one. I think it just makes it a little more complicated for using it, and it tends to push you into a forward position. So if you're using a walk-in shower, this would be inside. And then everyone, of course, with a walk-in shower, I shouldn't say everyone, most people have a little lip they need to step over, usually about 4 inches or so, give or take. If your walker fits into the shower, it's quite simple. If you imagine that the lip of the shower is right there and I'm going into the shower, I have you get your toes up as close as you can. Walker goes up and in first, and then I always have you step with the sore leg first. I find it's a little easier to get that one over, and then you're going to push through your arms and get the good leg over. This way you've eliminated the weight that goes onto that sore leg when you're stepping in and out. It would be the same way when you come back out. Now let's say you have a smaller shower at home and you're unable to get the walker in, which happens often. So in that case, we would have you back up. So if you imagine the lip of the shower is behind me, my heels are up against it, my walker's right in front here. This time you do the opposite. You do the good leg first. Good leg goes back and in, sore leg goes up and over. Walker is staying outside the shower because it doesn't fit. Then you would turn and you'd have the seat behind you and you'd sit. That's how we would recommend doing the shower transfers. We will, of course, practice this with you after your joint replacement when you're here in the hospital. Now, not everyone has a walk-in shower. Some have a tub shower. With those, some people will tell me, I'm just going to step over the edge of the tub. I'm going to step right in, and I'll be fine. I'll wait a couple days. Very rarely do we have a patient who can actually tolerate that, and the reason is at some point while you're stepping over that high edge, you're putting 100% of your weight on that surgical leg. And while it may not seem like a lot at first, it will right after a joint replacement surgery. And so being that it's such a high-risk area for falls, we would recommend using your shower chair. So I'll demonstrate again. Let's pretend that this is inside your tub shower. If this is the edge of the tub, you have your faucet over there, you're going to, with a family member of course, back up, so that the edge of the back of your legs is hitting the edge of the tub, your back as far as you can. And you'll of course have a family member, your spouse or whoever your care partner is, they're going to be there as your spotter to make sure that when you sit, you land where you want to land. So they line you up, you're where you should be. If you have a grab bar or you have something to hang on to, that's great. I highly encourage it. But if not, you lower yourself down, reach back, and you sit. So when I'm sitting, my feet are outside the tub, but my backside is in. Then you're going to turn, lifting one leg in and then the other. This eliminates you having to actually step over the edge of the tub. It's a little bit safer. Coming out, of course, it's going to be the same thing, lifting one leg in, then the other. Here's the part where it can get a little bit tricky. I don't like to have you grab from the walker and pull yourself into a standing position because the walker will tip. If you have a family member holding on to the bar in front right here, that helps to anchor it in place. It counterbalances your weight. So then I allow you to pull from the walker and stand. If you have a grab bar, that's even better. If you're strong enough to push up from the seat, that works too. Here at the hospital, we have a tub shower. We will practice this all with you and with your care partner before you discharge and make sure everyone is comfortable with how to do it. The last option for the shower is if you have a tub transfer bench, and that is this guy right here. This is set up for our tub shower here, which inside our shower, it's a little bit elevated, so looks kind of broken, but it's not. This is the Cadillac of the tub transfer benches. So as you can imagine, these two legs are outside the tub, these two legs are inside, and the edge of the tub runs in between. So all you have to do is sit on the edge right here, and as you're sliding across, you lift one leg in and then the other. Works very well. It's very, very safe. The two concerns that patients tend to have with this, number one is the size. You'll notice it's pretty large. You need to have quite a bit of room outside of your tub. So if you imagine or you go look in your shower and you kind of see where your faucets are, the direction you'll need to face, you need to make sure you have at least 6 or so inches to allow for these legs to fit outside. You'll also need room for you in your walker because you have to come over to here and sit before you can slide across. The other concern becomes the cost. This piece of equipment is more expensive than any of those other pieces of equipment I've showed you. It just depends on where you get it. They run typically upwards of $100, just depending on where you go. Insurance does not cover any of the equipment I've showed you. Unfortunately, it is an out-of-pocket expense. And we don't want this surgery to be more of a financial burden on you than it may already be. So if this is not a good option for you, that's fine. We will work with you and find a solution. But I would also like to point out that sponge bathing works just as well. Many patients prefer to go home and sponge bathe for a few weeks before they even go into the shower. And make sure you all have purchased your Glad Press and Seal. You're going to want that to waterproof your incision. I usually tear off a piece big enough to go around my knee twice. So you go and you start from the bottom and then work your way up to your thigh. And then you take that surgical tape, that white paper tape, tape down that top edge, and you're good to go. If you want to be extra thorough, you can tape down the bottom edge as well, but typically water doesn't go up against gravity, so you should be fine. You need to keep that incision dry for about 2 weeks after surgery. After that, the staples are removed, and then you can bathe with it exposed. Last thing we need to talk about is the height of your toilet. So what I would like you to do is to go into your bathroom, and I want you to back up to the toilet, and I want you to kick out the leg that's going to have the surgery. Kick that out in front of you so you're not using it. And then I want you to try to reach around for something to hold on to. Do you have your vanity on one side? Do you have a windowsill or maybe even a grab bar? Those are all great places to put your hand so that you can lower yourself down in a controlled manner. If you don't have any of those things, it's going to be a lot harder. It puts a lot more pressure on the one leg that you have. Once you're seated, I want you to try to get back up. Again, keep that surgical leg, the one you're having the surgery on, keep that kicked out so you don't use it. And then try to stand back up, again, pushing up from whatever you have around you. If you find that you're unable to get up and off of the toilet without someone helping you, it may be a good thing to start considering getting a toilet riser. There are many, many different options for toilet risers available. The main one we use is a riser like this that attaches to the toilet. It clamps on right here. They come with or without armrests, so that's something to consider. If you have a lot of things you can hold on to, you probably don't need these. And then they come with just the riser here. Of course, there's different heights. There's 2 inches all the way up to 6 inches, depending on, again, where you find your medical equipment. We also have what's called a safety frame. That is simply a set of bars, one on each side of the toilet, and it connects together with a metal rod, and that connects onto the toilet. It does nothing for the height. It just gives you something on each side so that you've got somewhere for your hands to go to help control you. The other option would be a commode. That's what we do here in the hospital. We take the bucket out from underneath, we put the commode on top of the toilet, and that allows you to have an increased height, and it gives you an armrest on either side. It's a great option as long as you have the room for it. You need to probably allow for 6 or so inches on either side of the toilet. Sometimes the vanity can be a little bit too close to allow that. So I think we've gone over most of the equipment that's available. Again, insurance typically does not cover any of these, so if you know right off the bat you want something that I've shown you in this course, I highly encourage you to go out and look for it. I'd like you to keep in mind that there are lending closets in the area. Grace Episcopal Church and St. Vincent de Paul are 2 of the lending closets we like to use. There's also different medical stores out there. There's CarePro, there's AIM, and depending on where you're from, maybe your town has one available. I've also seen things for the shower chairs and benches. I've seen those in retail stores, Menards and Lowe's, Target, Walmart. Some of those things you can get at those places. But if you're not sure and you think you might need it, but you don't know, maybe not, we'll work with you and we will help you get them and give you ideas of where to look. One other thing I would like to mention, when you're getting your walker, as Ryan mentioned in his video, you want to make sure that it fits you correctly. So all you need to do is make sure that your wrists are at where the handle is. That's how you size it to you correctly. Okay? Most of what I've mentioned you should find in your joint class book, which you will get at your PACE appointment when you come and visit the doctor. So you can reference that book. Everything I mentioned should be in there. As far as seats at home, we like ones that don't rock or recline, nothing that moves beneath you. We like them to have armrests. We like you to avoid leaning back in a recliner, elevating your legs. It can put your knee in a real bad position. It can hyperextend it, or it can keep it flexed. 19 to 21 inches is the average height for a chair at home that works with the average height of a person. So if you're typically a little shorter or a little bit taller, please make the adjustments from there. Other than that, I think we've gone over everything. So we look forward to seeing you when you come in for your joint replacement, and good luck. Thank you.
Good morning. I am Gretchen Ulmer, and I am one of the nurses here at Mercy Medical Center. I work on the orthopedic and neuro floor where you will be coming after your surgery. So today I'm going to talk about total joints replacement, the hip and the knee, and just the nursing part about that. So when you come to the hospital, you will be parking on the second floor, the south side of the parking ramp. When you go in, they will ask for a photo ID, and they will get you all signed in. They will bring you back to the room to just get your gown on to start an IV, and then you will meet with the surgeon and with the anesthesiologist. At that time, if you have any questions, they will be willing to answer them just to make sure that you feel comfortable with the surgery and the things that they will be doing. If you are having a knee surgery, it will probably take about an hour to an hour and a half, depending on your situation, but that's usually what we say. If it's a hip surgery, it's usually a couple hours, so just kind of plan on that. I always tell families when they come to the waiting room, it's usually pretty cold, so to bring a warm coat. They do have blankets there if you are needing one while you wait for the surgery to be completed. When the surgery is done, the patient that has had the surgery will go to what we call PACU, which is just a recovery area. We will look at the vital signs, make sure you're doing okay breathing, your blood pressure's okay, your heart rate's doing okay. We look at your pain. And then after you are stabilized and you're ready to come to the floor, you'll come up to the 3rd floor with where I work. Your family will be brought by a volunteer, and they will be shown into the room and made comfortable. We have a program at Mercy Hospital called the Care Partner Program. And this is a brochure, this is a little form that we have, and it just tells you that as a care partner, we want to make sure that we are taking good care of you too, because studies have showed that if we are caring for the patient's family member or friends, that the patient is much more at comfort level and is willing to work with the families and the staff to do what is needed so that they can get better quickly. So we want to make sure for the care partner that we are taking care of you, so just please communicate any needs that you may have. Another thing that a lot of people have questions about is regarding pain. So we want to make sure that when you come on our floor, that even though we're still looking at your vital signs, making sure that your blood pressure is doing well, your heart rate, that sort of thing, we also want to make sure that you know we are going to be watching how your pain level is. So we have in every room, it's not this big, but we have a scale that we ask quite often what you're rating your pain at. And this is what we want you to look at. 0's no pain, 10 is the worst, and that helps us kind of get an idea of where you're at. But let's say that your blood pressure is, you give me a pain rating of 2, but when I take your blood pressure, it's way up high. So even though you tell me it's a 2, if I'm seeing that your heart rate's up and your blood pressure is up, we're going to treat it that you have probably more pain than what you're stating. With the doctors, all the doctors are really good at providing different medications for the nurses to utilize for your pain. So when you come on the floor, we will ask you kind of what you have used in the past at home to relieve your pain, just to give us an idea, a baseline, what we will start at. With any kind of pain medication, we also have in the rooms a purple laminated sheet. It looks like this. We have you rate what you want your goal of pain to be. So this is a 3 up here. So we just want to make sure that you have 3 as like if that's what you're stating to achieve, written up there. And then we document what your pain medication is, how much you're getting, and what time you will be receiving it. And we'll talk to you in detail about what your medications are and make sure you are understanding them. Usually your oral pain medication that you take by mouth is given every 4 hours, but we come back and check quite frequently to see how your pain level is. So if we would just give you one pain medication, one pill, and we came back in maybe half an hour, 20 minutes, half an hour later and see how your pain was, if you're still having high amounts of pain, know that we aren't going to wait the 4 hours to give you more pain medication. We're going to go ahead and treat that pain medicine right away to you, just depending on what you're needing. We also provide ice. We want to make sure that with like the knees, that we are putting ice above and below your knee. And we also, for hips, put ice on the surgical site. So that's something that you may want to purchase in advance, are like ice bags. We do have a medical store here at the Mercy Hospital that you can purchase ice bags that are really nice to store in your freezer so you're prepared before your surgical date. And they cost about $7 a piece. So knees, you'd want to purchase 2 ice bags, and hips, you'd want to purchase 1. Another thing when you're on our floor that we're going to be looking at, besides doing our vital signs and looking at your pain, is we're going to make sure that you're doing good with your deep breathing. We want to make sure we prevent any kind of pneumonia issues, so we'll be having you do some really good deep breaths and doing some coughing. We also utilize, and you may be familiar with this, it's called the incentive spirometer. And what you do is you suck through the mouthpiece just like you were sucking through a straw. And then you keep the blue nugget between the 2 arrows. So it would be a nice gradual intake of breath. So this is how you would do it. And then you just relax. We usually ask you to do this 10 times every hour. We won't wake you up in the nighttime unless you get up to go to the bathroom, then we'll have you utilize this. But that's how important this is. And you can bring this home and utilize it too at home. So this is an incentive spirometer. It's very important, like I said before, that your pain is under control so that you can get up and move around, because we want to prevent blood clots. We also use TED hose, which are like white stockings that are pretty secure to your leg. They help just to give security to your blood vessels. And we also use like these little massage things that go around your calves. They're called SCDs, and they just kind of deflate and then they inflate like every 15 seconds. We encourage you to wiggle your toes and wiggle your feet. It's very important just to keep that moving. We check your pulses in your feet. We check your bandage that you come back with after your surgery. Just know that there's going to be a lot of checks that we do. With the dressing that is on, with the knees, you will have your dressing from above the knee to basically to your, almost to your toes. And then that's for knee surgeries. For hip surgeries, you guys will usually just have like a 4x4 on your surgical site, some kind of a dressing, and then some tape around it. Depending on the doctor and their orders, they may have us change that the next day, or it could be a couple days. It just depends on the doctor what they do. But we will read the orders and make sure we do as they have ordered. If you have staples, those are usually removed 2 weeks after you leave the hospital, and it's usually done at the doctor's office. With your diet, you will have, like I said, an IV, and so we will keep the fluids running, but we will give you ice chips initially. We will have you take fluids, Jello, those light fluids initially to see how your stomach's doing, and then progress after that. If you're doing well with the Jello and you need more soup, something like that, will advance you as we see that you're tolerating it well. Before your surgery, you're not going to want to have anything after midnight. You want to make sure if you do take some pills in the morning that you have been okay to take for your doctor, you can take some sips of water, but otherwise do not take anything by mouth. The supper before your surgery, you can have a nice meal, not a whole bunch of food, but just have a nice meal so that it can kind of sustain you for the next day. And then, like I said, then after your surgery, we'll start out with the clear liquids. When you decided to do your surgery, from that moment until you are discharged, we have been providing education so that you feel that you are going to be as safe as you can be, and have the most information you are needing to feel comfortable with your cares that you are going to be doing along the way. And so, talking about discharge planning, when it comes to that time, you will meet with the social worker during your stay at the hospital, and they will visit with you to find out how you're doing with physical therapy and occupational therapy. If you're doing really well and your plan is to go home, then as nurses, we'll prepare those discharge papers and then present those to you and make sure that you're understanding them clearly before you leave the hospital. And usually discharge is about 3 in the afternoon. You can plan as like the latest to leave the hospital, just so that you kind of have that idea that it takes that long to work with therapy and have the doctors do the discharge orders, and for us nurses to get the papers ready to present and provide the education to you. But let's say if the social worker works with you and meets with you and you're not ready to go home, maybe you need to go to a skilled facility, maybe you need home health, just know they will be visiting with you and setting that up with you, and just let them know what you're feeling and communicate your concerns and your needs. That's very important for us. Every morning we meet as a group. It's called Care Conference. So you will meet with a care coordinator during your stay. You may meet with a hospitalist. You may meet with our nurse practitioner, the social worker, of course us nurses. So lots of names, but just know you will get to know us, and then we just want your stay to be as pleasant as possible while you're here. Just know that in the booklet that you receive, usually during your PACE appointment, on the back cover there's a card that talks about total joint replacement. You need to put that card within your purse or wallet, and then anytime you have any dental procedure, you just need to make sure that you know what your doctor and the dentist have communicated regarding antibiotics prior to any cleaning or any procedure that may be done. I had mentioned earlier that you want to purchase ice bags and keep them in the freezer before you come to this for your surgery. Other things you might want to think about so you don't have to do it afterwards, after your surgery, is to have like a multivitamin, to have a bowel softener, and just make sure your pathways are all lit up clearly so you can see in the middle of the night. We find that people get up to go to the bathroom quite often. And we just want to make sure that you're safe. Also, your pathways, make sure they're free from, you know, like throw rugs. And then the other thing that I want to make sure that you're aware of is that if you come to the hospital, you can bring comfortable clothes with you. Some people don't like our gowns and may want just comfortable shorts or elastic band, sweatpants, slippers that have a good sole. A shirt, that's all fine, whatever you feel comfortable in wearing. And then you can bring your laptop, your tablet, books. I can't guarantee you're going to have a lot of time to do those because we do keep you busy and keep you active. But you can bring those. If you have a BiPAP or CPAP, you'll want to bring your tubing and that along with you. You are, at this point, able to bring inhalers or eye drops. We'll relabel them in the pharmacy, but you can utilize those on our floor. All the other medications you can leave at home. Our pharmacy takes care of the medications for you while you're here, unless you've had an organ transplant or are on special medications, maybe for cancer. You can talk to your doctor about that or us when you come, but you can bring those medications and we'll relabel those in our pharmacy also. Well, I thank you for choosing Mercy Medical Center, and I look forward to taking care of you.